back, everyone, with Common Sense Revisited. Thank you again for joining us today. And we have with us now, who I'll bring on, Mr. Jake Towne, running for a U.S. House of Representatives from the state of Pennsylvania. Jake, are you with us?
Yes, glad to be with you, Clyde.
Yeah, absolutely. Great to have you on again, Jake. I'm very excited today to have you, and I want to talk about a lot of things. I think that what we should start with, since it's such a hot topic right now, is health care. I know you've been hearing from constituents and going to meetings, and health care is on everyone's mind. Why don't we talk a little bit? I know that let's start with the that wonderful analogy that you use to explain the health care system. And why don't you just share that with everyone today? And let's just start from there, talking about, how we can fix our health care system, why the Democrats and Republicans both have it wrong.
Sure, Clyde. I mean, it all comes down to the free market versus socialism. But the analogy that I wrote is it's really like a chocolate candy store. And imagine that you yourself own this type of store, and you go out and just like any other business, you try to get the best suppliers, the best employees, keep your costs competitive. And what happens is people eat too much chocolate and they start getting health problems, and they end up suing you. And after they sue you, you have a choice. You either increase your prices to pay for all the lawyer costs, or you go out of business. So most people choose to increase the price of their chocolate. Second step is, the government, which is happening right now, decides that, hey, you are overcharging people for chocolate, so the best thing to do is to open up a new candy store with cheaper prices. And when they do that, this lowers their prices below what you can charge because you got hit with all the lawsuits. And what people will start to do over time is they'll decide, okay, I'm going to go buy chocolate now from the government-run store because it's cheaper. And they start flocking over. And eventually what that'll do to the private businesses is they won't be able to compete, and they'll end up closing shop. And that's actually where we get the dangerous part, because a government-run business would not, like this candy store, you can't really beat it. Like, they'd always be able to go into debt because the government has basically a never-ending pocket. So what ends up happening is you start getting lower quality chocolate because, again, there's no competition. So eventually, you end up having a government-run candy store, and people have to decide, the government's going to eventually need to cut costs as well. So right. You end up with a competition problem. And where I try to relate this back to healthcare is, we're not really dealing with chocolate, like we're dealing with people's lives. And once this system is in place, which will actually further expand the government-run aspects in healthcare, it'll be pretty much impossible to destroy it without hurting millions of Americans. And even now, we already have Medicare, we already have HMOs from the government, and that also is hurting people. So we're really kind of stuck in a lose-lose situation, which to a larger degree is actually the responsibility of these politicians who are meddling around with the free market.
Right. Well, it's nothing different. Nothing is new under the sun when it comes to government. Basically, what they do is they get involved, make a situation worse, and then to fix it, do more of the same. So it goes the same way for education. It goes the same way for our monetary system. It goes the same way for drugs. It goes the same way for healthcare. So when they started the healthcare system, the meddling with the healthcare system and under Nixon with the HMOs, and then later Lyndon Johnson with Medicare, it's just really made problems for the medical system, the whole medical situation. They aren't the only ones to blame, though, Jake. We talked about this a little bit earlier. It's also the AMA and other and some of these big insurance companies as well. Become very powerful lobbyists in Washington. They get their way. And let's not forget the pharmaceutical industry, because probably the biggest player, the biggest influence on this current health care bill is the pharmaceutical industry. They've signed off on it. They're going to do very, very well under this bill. And they have their interests at heart. So, there's a lot of big players, all surrogates, like we call them in Common Sense Revisited, all surrogates, institutional power that's going to be running this whole thing. And these big institutions are the gainers while the individuals are going to be the losers. And you're absolutely right. I mean, what's going to happen, like with your chocolate store? Well, first of all, the chocolate store that you're talking about that the government is going to create is funded by us. So this healthcare system that's going to be supposedly provide cheaper healthcare is going to be funded by all of us, either through our tax dollars or through the printing of money out of thin air, which we pay the interest on. So either way, we're going to be paying for this. So it's not free. It's not going to reduce costs. It's going to increase costs because everything the government does, and I think we clearly show this in common sense, and I know you know these numbers, but basically anything the government gets involved in, they take about 75% to run it. In other words, for example, in education, all the federal dollars that go to the Department of Education, 75% stays in Washington, D.C., 20 to 25% actually goes back to the local schools. Same with welfare. So it's going to be the same way with health care. Where all the money is going to end up going is to government bureaucrats.
Absolutely, Clyde. And what I also like to try to point out is, look at other government-run industries like, for instance, Amtrak. I mean, most people have never taken an inner-city train in their lives because Amtrak in the 70s, government was supposed to come in there and take over it for 3 years and then hand it back to privatized industry. They held on to it, and they now operate it at a loss of billions of dollars each year. And you can take a look at the U.S. Postal Service. They're having all types of problems with their pensions and profitability, and they actually even control the cost of stamps.
Yeah.
So what you'll end up having in terms of health care is the same thing that always happens in any of these plans where the government is trying to run things, is you have rationing and you have price controls.
Right. Well, and I have socialist friends who actually believe that price controls are the only way to quote, control this thing. Control is always a part of their vocabulary. But when have price controls ever worked? All price controls do is create black markets. And so that's what's going to happen. It's going to be if this thing passes, either the Republican version or the Democrat version, it's going to be much, much worse. It's going to be very expensive. It's going to balloon the deficit even more. And it's going to end up making health care less of a lesser quality than it is now, and less choice. So we need to defeat this thing, but the Republican plan isn't any better. Would you agree with that?
Oh, absolutely. Actually, the incumbent Republican that I'm running against in my district in eastern Pennsylvania, his name is Charles Dent, and he is actually a co-sponsor and co-writer of the Medical Rights Act. I think I got the name right. But it's the Medical Rights and Reform Act. And if you read that bill, I mean, he sells it as if it's, the Republicans sell this plan as if, the government isn't involved and whatever. But if you actually go and read it, it says things like, let me get this quote here, quote, it will foster state innovation. I'm not quite sure what exactly state innovation is, but through insurance market reforms, high-risk pools, community health networks, and new association options for small businesses, unquote. And it promises to basically socialize medicine the same way that the Obamacare plan, H.R. 3200, does by, quote, giving low-income families the option to use public funds to purchase private health insurance plans, unquote. So it's all the same game, and I think I was pointing this out to you earlier. If we go back and we look at the last decade, we had, for a little while, we had George Bush, Republican president, with a Republican Congress, and things very quickly went down the road to serfdom, towards more socialization. And for a little while, we had a Democratic Congress with a Republican president. We had a little bit of a check on things, and now it's flipped completely. We have a Democratic Congress, Democratic president, and we're back on the express train again. And just the Republican health care plan might be better. It might be the lesser of two evils, but in the end, it's going to result in the same overall effect as the Democrats' plan. It's just, if the Democrats are an express train, the Republicans are basically just the local train.